I'm Professor S.K.Chugh, MD in Medicine, with additional qualifications. The title of my talk today is Role of Vitamin C in COVID-19 pandemic. I will be speaking about the importance of vitamin C before a person lands up with COVID-19, during COVID-19, and when he recovers in the post-COVID period also. The health of an individual is directly dependent on the food that one eats and the environment in which one lives in. Way back, World Health Organization for the first time came out with a monograph suggesting interaction of nutrition and infections. Also suggested that the biological effects of malnutrition and infections combined together had a greater impact on the growth and development of individuals. This also explains an important correlation between biological effects of infection and nutrition on humans. The monograph also explained an impact of nutrition on the immunity of mankind. It also established a meaningful correlation between the fall of immunity and insufficient nutrition. Simultaneously, malnutrition and infection both led to depressed immune responses. An unhealthy person is not only prone to further infections, but these infections also diminish the important vitamins in the body which undergo depression. For example, vitamin A, vitamin B, and its components like niacin, thiamine, and vitamin C. Hence, the bacterial and viral infections also suppresses nutritional components. What made us choose vitamin C over other nutrients and other vitamins? As vitamin C is the most powerful antioxidant and it destroys the radicals which are harmful, free radicals which are harmful for the body. Vitamin C also gives signal to the T cells of the immune system so that the virus can be taken away from the body. It is destroyed by vitamin C and its signals to T cells in the immune system. Several research studies reveal nutrients provide body with resistance to fight infection. Vitamin C is one of the most important nutrients in our daily diet. The saga of vitamin C and its deficiency is as old as the year 1497, when Vasco da Gama, with his colleagues, more than 160, 100 of them suffered from ailment resembling scurvy, and they happened to die suddenly due to heart failure. It took the scientists another 50 years to come across an experimental model like guinea pig to decide that this scurvy was secondary to vitamin C deficiency and they died of scurvy. Those very days, some scientists made observation that those mothers who don't take fresh fruits and vegetables and happen to get pregnant and give birth to the newborn babies, some of them also had sudden death. So more attention was paid to the fact that the patients were dying, those who were avoiding the intake of fresh fruits and vegetables. Vitamin C plays a very important role in the formation of collagen in connective tissue. Hence, if the vitamin C is deficient, It gives rise to abnormal collagen tissue. There is delay in healing of wounds and also leads to capillary bleeding and abnormal platelet stickiness. Now I'll speak about the sources of vitamin C. Mainly, they are found in fresh fruits, citrus fruits, oranges, pineapple, potato, sweet potato, lime, sweet lime, papaya, and so on and so forth. It's also present in vegetables like spinach, lettuce, and other green vegetables. The non-vegetable diet has very little amount of vitamin C. So those who do not take fresh fruits and vegetables end up with severe vitamin C deficiency. In non-vegetarian diet, except for small amount in the liver and glandular tissue, no other organ has vitamin C. So the vitamin C deficiency is more common in those individuals who are totally non-veg. Synthetic vitamin C tablets are also available. Recently, injection vitamin C is also available, but we use it very rarely under extreme circumstances. Deficiency of vitamin C leads to scurvy, which is swelling of gums, redness, and bleeding, even on brushing teeth. If there is superimposed infection, then there is foul smell from the mouth, and one by one the teeth start falling. Other deficiency symptoms are with the problem with the capillaries. They bleed in the lower part of the thigh. There are petechial hemorrhages near the hair follicles. These bleeding can be in any part of the body. The bones in the lower legs become weak because vitamin C gives good health to the bones, and deficiency causes thinning of bones. They are also called woody legs, and there may be petechial hemorrhages near the ankle joint. On the other hand, vitamin C helps absorption of iron and prevents iron deficiency anemia in these patients. The nails become concave and there may be splinter hemorrhages in it. The skin becomes rough and vitamin C replacement is required. To begin with, patient feels fatigue, patient has anxiety, depression, and those who already have mental disorders, they are aggravated. There is indigestion, loss of appetite, pain in abdomen, and diarrhea. Patients with severe scurvy have been reported to undergo sudden death due to acute heart failure. Vitamin C is an important nutrient of human beings. It is a simple sugar. It's soluble in water. A reasonable quantity of vitamin C leaves the body via urine. Vitamin C is very sensitive to heat. If you cook our vegetables, 75% of vitamin C is destroyed. It's also very sensitive to alkaline substances like soda bicarb. It gets destroyed. Use of vitamin C to prevent scurvy and helps in healing wounds, including burns, also acts as neurotransmitters, is an antioxidant and useful in cancer patients. It gives heart healthy. It precipitates in hormone production and various enzymes in the body. It also is present in the adrenal gland and eye in humans. Management of vitamin C deficiency needs extra doses of vitamin as required in smokers and those who use tobacco, alcohol, and people with mental disorders. Pregnant ladies lactating and feeding their babies also need extra amount of vitamin C. To begin with, we convince the patient to take vitamin C as dietary products, fresh fruits and vegetables, but also advise them to keep hygienic conditions which give them daily dose of vitamin C in the form of tablets. In extreme rare conditions, intramuscular injection is given. The complications created by vitamin C deficiency are treatable, they are reversible. They may not lead to permanent damages. Pregnant and lactating women who need extra doses of vitamin C are also convinced to take fresh fruits and vegetables. Overdose of vitamin C can also be harmful, that is, more than 2 grams per day. It causes degeneration of kidneys, kidney function tests deteriorate, and patient may develop oxalate crystal and stones in the kidney. Research studies have shown that patients in USA who underwent lung transplant were also given intravenous vitamin C in the form of saline solution. But as the kidney function test deteriorated in some patients, this infusion and this treatment was abandoned. Some people claim prophylactic dose of vitamin C can prevent cold, coryza, or nasal congestion as per the literature. Vitamin C and COVID-19. Vitamin C is known to be a very powerful antioxidant, so it can improve the strength of human natural defenses. Antioxidants are those molecules which can boost up the immunity of human beings. They do so by protecting the human cells from harmful effects of other molecules named as free radicals. As these free radicals accumulate, they can promote a state known as oxidative stress. The oxidative stress has been linked with many chronic diseases, including bacterial, viral, and I suppose even coronavirus. Research has revealed that vitamin C consumption can increase the blood antioxidant level up to 30%. This helps the body's natural defenses, fights inflammation, which is the hallmark of COVID-19 disease. So friends, my conclusive remark is that patients who are ill or in the pre-stage of COVID disease or have recovered from COVID should be given vitamin C as a prophylaxis and as treatment, because COVID also has deficiency of vitamin C in their diet. So if they take vitamin C pre-hand prophylactically, maybe they will escape getting the disease, and during disease we increase the dose of vitamin C, and when they recover and go home, they should take fresh fruits, vegetables to compensate for vitamin C deficiency. Thank you. My dear friends, if you like my video, do share with your friends. Give me a thumbs up and subscribe to the channel and give your comments.